Total Parental Nutrition and Home Care. My name is Erica Hussey, and I chose this topic because it plays a critical role in sustaining life for individuals who cannot eat or absorb nutrients through the GI tract. My presentation will cover what is a TPN, why TPN, the additives and ingredients of a TPN, TPN administration, hospital to home, patient education and self-care, IV care and infection prevention, and empowering patients for better outcomes. What is TPN? TPN is Total Parenteral Nutrition. It is a clinical nutrition method that provides essential nutrients intravenously by bypassing the digestive system. It is tailored to meet patients' specific nutritional needs and recovery goals. Additives in a TPN are essential to meet patients' nutritional needs and support overall health. TPNs contains ingredients tailored to patients' specific medical conditions and delivery methods. Registered dietitians tailor TPN formulas to meet patient needs by calculating and adjusting the formula and monitoring each patient's response. So the additives and components that are in TPN are carbohydrates, glucose, dextrose for energy, proteins, which are amino acids, are involved in tissue repair, immune function, and growth. Fats, so lipids are essential fatty acids and dense calories. Electrolytes, sodium, potassium, calcium, magnesium, and phosphate to maintain the balance of fluid, nerve, and muscle function and regulate pH levels. Vitamins that help prevent deficiency and support metabolic process. Multivitamin solution meet daily requirements. Trace elements known as micronutrients, zinc, copper, manganese, and selenium to prevent deficiencies and support metabolic process. H2O is to maintain the hydration and help with cellular function. Nutrients are tailored to the patient's needs by a registered dietitian. The route of administration for TPN is intravenous, bypassing the digestive system. It is delivered through a central line which ensures the direct delivery of a complete mix of nutrients tailored to the patient's specific needs. In this slide, there's a TPN bag and tubing that is connected to the patient. This is how a TPN is administered. When transitioning from hospital to home care, TPN patients require comprehensive education to manage their nutritional plan effectively. Malnutrition education is crucial for patients to understand their dietary needs at home, manage their nutritional plan, monitor their health, and know when to seek support from a healthcare provider. Here's a brochure that I put together to promote and provide information about patients on TPN. Here is the flip side of the brochure and a picture of me providing information on TPN nutrition and the ingredients it contains. I also added a self-care checklist to empower patients to follow the regimen, promoting recovery and preventing nutritional deficiency. Proper education and a structured approach to self-care contribute to better outcomes and a smoother transition. Understanding how to safely manage TPN outside of the hospital is crucial. This topic highlights the essential role of nurses in patient education, monitoring, and preventing complications, both clinical settings and in a community. IV care and infection prevention is all about proper hygiene, site care, signs of infection, how to avoid disruption, fluid management, and emergency awareness. So of course, proper hygiene includes washing hands thoroughly before and after touching the IV site or port. Keep the IV site clean and dry, follow dressing change instructions, watch for redness, swelling, pain, or discharge at the site, avoid unnecessary touching or manipulating the IV line, and ensure the IV fluid Bag is changed as instructed and remains uncontaminated. And know when to contact if the IV malfunctions or infection signs appear. IV and TPN care and infection prevention. This is a picture of me on the bottom instructing or educating patients on how to proper hygiene site care or how to flush a line. Patients must recognize signs of infection and understand emergency protocols for IV malfunctions. And this is just proper guidelines and proper hygiene, site care, and fluid management. Patient empowerment. We have patient engagement, patient involvement, patient enablement, patient communication. This is basically to empower patients for better outcomes. We stress the importance of patient education to ensure adherence of TPN regimens and facilitating a smoother transition to oral feeding when appropriate. The highlight role of this education is promoting recovery and preventing nutritional deficiencies, so that people who do home care, TPN home care, can be with their loved ones and, kind of have that daily routine of a normal, somewhat normal life. And thank you for taking the time to listen to this PowerPoint. I hope you folks enjoyed it. Have a great day.